Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Very happy 2021. I hope you had a great New Year's Eve yesterday and you're all fired up and looking forward to a fantastic 2021. I've got a client here who attended with bilateral occluding earwax. So bilateral means both ears. Occluding means when the earwax is completely obliterating the ear canal. There's no gaps for sound or air to travel through. The patient is an elderly patient and does wear hearing aids. And you can see the hearing aid itself had embedded against this wax. It had kind of lodged and pushed it in. Elderly patients and patients who wear hearing aids are much more prone to earwax impaction. And that's because as we age, the ear canal, the skin that lines the ear canal gets a lot drier. The ear canal, the earwax itself also is a lot drier. So if you've been watching my videos, you should be aware that for 95% of the population, earwax naturally migrates out of the ear. And that's because the outer layer of skin cells that line the ear canal, the epithelial cells, as they shed and die, they naturally migrate out of the ear. It's similar to a snake's skin. When a snake sheds its skin, the skin of the ear canal, it's evolved to die, shed and migrate outwards, almost like a conveyor belt. And during this conveyor belt motion, the earwax that is secreted on top of this layer of epithelial skin cells also comes out. But as we get older, the skin, because it's drier, it doesn't migrate out as well. And also a hearing aid can push this wax in. It's stopping the wax from naturally migrating. You can see the patient's got a lot of dead skin wrapped around this plug of wax. It's all the white, glossy, textured skin you can see there that's attached here. So as the skin sheds, it's white and you can see there, and then as it oxidizes, the longer dead skin is in the ear, it becomes a yellowy color and then a brown shade and almost black. So eventually dead skin can resemble earwax. It's got a very similar color to it if it's been in the ear for a long time. So I'm just using a Zollner suction probe and just gently wriggling this out of the ear. Patient was, despite her age, she's very elderly, but she's very still. She actually enjoyed the procedure. She said she found it very therapeutic. The patient in the past had irrigation, so that's when water is flushed at a controlled rate into the ear canal. The concept of irrigation is that the water, when it's pumped into the ear, it travels along the ear canal walls, it literally hits the eardrum and it flushes backwards, back out, and as the water comes back out of the ear canal, the theory is it flushes out the earwax. It can be effective. It's been previous to irrigation, it was a procedure called ear syringing. That's an old metal syringe that's banned in the UK. I'm aware in some states in the US that ear syringing is still taking place. I attended the AAA conference, which is an audiological American conference. I think it was in Florida a few years ago, and there was in the exhibition halls, there were stalls that were still selling the old-fashioned metal syringe. I was quite surprised, and I spoke to them because now in some states in the US it's still being used. In the UK, these metal syringes are often found now in museums. They're not used in patients' ears. They can cause a lot of injury and harm. The pressure with those metal syringes quite often could perforate the eardrum and obviously lead to an ear infection. So the patient's used to having ear irrigation being performed. With irrigation, you have to use earwax drops for at least 10 to 14 days prior to attending to soften the wax. During those 10 to 14 days, the earwax will absorb the drops and expand and swell and create more of a blockage and exacerbate the patient's symptoms. And quite often when you've got that much earwax and it's been dosed with earwax drops, you can't wear your hearing aid because the hearing aid will whistle. You get acoustic feedback. So when you've got earwax and you wear a hearing aid, if the hearing aid starts whistling for no apparent reason and it's inside your ear correctly, it's inserted correctly, the amplified sound hits the earwax and the earwax acts as a barrier. It reflects that amplified sound back out of the ear canal, and that amplified sound re-enters the hearing aid microphone, and that sound is re-amplified. And it creates a vicious cycle because that re-amplified sound enters the ear, it's reflected back out the ear again, it re-enters the microphone, it's amplified back into the ear. You can see where I'm going there. So if you get a feedback loop, this sound is being continuously re-amplified and re-amplified back into the ear, and it re-enters the microphone. So it causes a really high frequency squeal that other people can hear. So in the UK at least, I don't know how it is in America, but ear irrigation, it's on the decline. As I said, it can be effective, but it has got inherent risks. Water in the ear is the arch nemesis. Water can cause ear infection. If you've got a cleft palate or a mastoid cavity, or you've got a foreign body, you can't perform ear irrigation. The earwax must be soft. As I said, if it's hard, it could lodge it further in. If you've got a perforated eardrum, or you've got a grommet, which is a ventilation tube or a T-tube, water can get into the middle ear and cause an infection. Also, with ear irrigation with water, you always run the risk of developing an ear infection. There's been cases of patients that I've treated in the past who have had ear irrigation performed elsewhere, developing what we call malignant or necrotizing otitis externa. It's very common in the elderly population and those people who suffer from diabetes and autoimmune disorders, or who are immunocompromised. Water can cause an ear infection, otitis externa, and the malignant otitis externa and necrotizing otitis externa is very dangerous. It's almost life-threatening, and it's assumed people who are diabetic have got a reduced immune system, so as the elderly. As your ear canal, the outer ear, is infected, because your body can't naturally respond to it, this infection can spread like wildfire. It can infect the bone behind the ear, it can affect the bone at the base of the ear canal, the tympanic plate. It can also spread to the temporal bone, which is the bone just below your brain. It can also then, the infection can spread to the meninges, which is a fluid layer that coats the brain, and that can then cause meningitis. In other words, if you develop necrotizing, or another name for it is malignant otitis externa, it can be life-threatening, and the main cause of that is water entering the ear. Sorry about that, guys. I just thought that'd be interesting. It's good. I think I should explain that. So that's why ear irrigation is on the decline in the UK. Many primary care centres in the UK, so GP centres, are no longer offering any form of earwax removal. Their typical mode of earwax removal is irrigation. So a lot of people in the UK are now having to seek private ear care, or they have to get referred to secondary care at the hospital, ENT, which could be months. I know I've had a few questions from people in America to explain how the provision of ear care is provided in the UK. I hope that provides a bit of a framework. Sorry guys, I've talked over that video. So this is the patient's right ear. The wax was a bit drier. There's a big piece there, so I got some of it out with microsuction, went back in with some forceps, got a big plug out. Both eardrums are healthy, intact. Because the patient does wear a hearing, they actually brought their hearing aids in, and both hearing aids were she had an old-fashioned hearing aid, what we call a behind the ear. Well, when I say old-fashioned, it's still, people still wear that, but nowadays there's many more discreet styles of hearing aids. It's an NHS hearing aid they had. You have a tube that runs through a mould. Both tubes were blocked with dead skin and wax. So I want to just mop up as much debris as I can to prevent their hearing aid from getting blocked. The patient also had moisture in the tube condensation, and that's possibly because of the wax. And then when you've got moisture in the tube, the sound doesn't travel through, the water absorbs the sound being pumped through the hearing aid. That's all the remnants on the tissue. I hope you enjoyed that video, guys. You found it informative and educational. As I say, enjoy the rest of your New Year's Day, and I'll upload some new videos across the week, during the week. Take care, guys. Bye.